Hi, everybody. Here we are already in the middle of October. What's very interesting this week is that the first significant snowstorm is making its way across the country. And I happened to have flown last night across the country in San Diego now for a public safety meeting. So that's a little bit of why a hotel room is behind me here. I wish I could show you the beautiful San Diego harbor behind me. It's beautiful here. But coming over the country is a big rain and snowstorm. And so, for those of you who love winter weather, you're here. And for those of you who need a little water, around in your yards and to make sure that the fall season is beautiful. It's coming your way. What's also coming our way is our respiratory virus season. A lot of activity going on. So let's break it down a little bit here on Doc Talk and figure out what our strategies are for the fall. Three bugs that we keep talking about: RSV, which is the baby respiratory virus, but also affects middle age and older people. And in older people can cause some significant harm. What's new this year is vaccines, and there are vaccines related to the real at-risk group, which is the elders and the youngsters, which really does mean newborns through about 3 years of age. So we have new targeted vaccines for those. You'll hear about them if you're in that age group, or if you have an infant, and particularly for the young members of our public safety force who have little kids, this is worthwhile for you. So here we are. There are vaccines for the seniors that are available for RSV. Talk to your physician, see if they're right for you. Low risk in terms of side effects, high effectiveness protecting you from particularly severe RSV. For children, new strategies. One, immunize the pregnant woman at the period of time where she can form antibodies and deliver them to her newborn child. That's a really good strategy, a sound strategy for protecting the newborn from RSV. The second is to give children monoclonal antibodies to protect them for a season at a time or 2 seasons. That is a very new strategy. It frankly comes out of what we've learned about COVID, and monoclonal antibody injections for newborns and young children, particularly those at risk for complications of RSV. That's a good strategy. So there we are for RSV. Seasonal flu, it's out around the country already, including in the areas where I work and I live. We have so far a good match of the seasonal vaccine. It's rolling out a little bit slowly, so the numbers of vaccines available are not particularly high, but you can talk to your retail pharmacist or your primary care physician and get immunized with the seasonal vaccination. For those of you 65 and older, they give you a little bit higher dose of the flu vaccine to protect you. It's good. Let's talk about then our old friend COVID. So it's the third element. It is in the country. It's causing some more hospitalizations, not at the level where we've seen the past 3 years. Strategies are still the same. Here I am. I've traveled. I wore my mask all the way across to make sure I was protected. Since I am protecting myself from other people, this is an N95. The N95 is protect you from other people. Here is a surgical mask that protects other people from me. I only wear one at a time when I'm traveling and in crowds, and that is the N95, which provides a much more reasonable filtering of air coming into your respiratory tract. So if you're interested in protecting yourself, it's the N95s. They are available now. They're available from your agencies, organizations. They can be bought over the counter, etc. So the strategy is still here. For those of you working in the service in EMS, we have a number of nursing homes, senior care facilities that have had extensive spread of COVID. When you go in there, particularly for anybody with respiratory complaints, this on you, this on the patients that you're dealing with to protect you and the other members of your department. Testing for COVID. Free tests are available once again. If you'll just tap in COVID tests or COVID home tests, you'll get directed to the web link for the CDC, who's disseminating free tests again. They're effective with the newer strains of COVID, and so it's a really good idea to have those available to be able to pick up the free home tests. They are still very sensitive and specific. And there's even some talk. Listen to this because you'll hear this in the news. There's even some talk that the quicker that test turns positive, meaning you have a higher load of that virus in the swab that goes in your nose, the higher load that creates a positive test result very quickly means you're more infectious. If it takes the full length of time, 2, 3, 5 minutes for the different tests, if it takes the full time for the line to turn positive, that means you have relatively less of the virus in your nose and available to spread to other people. So tests, having them available in your work site, in your home, be able to protect people at appropriate times, that's an addition. Positive tests means from onset of symptoms or the test, you are infectious for the next 5 days. It's best for you to be away from people. If you're in a job where you have to go in and you're not very symptomatic, meaning you're not coughing like crazy and creating, real concern about people around you, you can go into work in a well-ventilated area with a mask on you. And typically that means the surgical mask to begin with, but some people will be more comfortable if you're using the N95 if you are sick. The longer that you can stay away, meshing it with weekends, etc., and staying away from other family members who may be at risk. That's the strategy still. 5 days, and then 5 days after that, you continue to wear a surgical mask, in public areas. So that continues to be our strategy. How about the vaccine? So we have 3 versions of the updated vaccine for COVID available now, made by Pfizer, Moderna, and Novartis. Novartis is the unique one that was approved last. That is a protein-based vaccine, seemingly has very similar protection to the Pfizer and Moderna, which are recombinant mRNA vaccines. Those remain to be very effective in prevention of infection at all, and in particular in prevention from severe infections with COVID. Strategies, I've heard from people, some believe you should mix your vaccines. If you got Moderna before, get Pfizer this time. There are some strategies that have you take the protein base, so that's the Novartis vaccine. There's relatively little difference in cost. And at this point, employers are providing the vaccine for free to workers, particularly in public safety. At the personal level, there are different levels of costs available from your primary care physician. Some insurances are covering the COVID vaccine, some are not. And for those that can't afford it, there are free vaccines available. Tap in your computer. Can I get a free COVID vaccine in my area? We don't have the big public health and public safety vaccine programs going on now. Most of these are available through the routine retail, which is the CVS, Walgreens, et cetera, that can provide the vaccines. In some cases, those are free. So we are at that stage. We'd really like to keep respiratory viruses from attacking us in the community. I will be getting in the next couple of weeks my COVID and flu vaccines in either arm at the same time. No problem with that. I'm not at the group that likely would benefit from RSV, so I'm not in line to get that vaccine personally. Others may be. I do want protection from the flu and COVID, even though I've had 4 immunizations already and I've had the disease. So that's what we call 5 immunizing events for COVID. And you're not going to hear the term booster used for COVID, just so you're aware of that. It's an updated vaccine, so they will refer to it as the 2023 vaccine, the updated vaccine, in that kind of terminology. It is not a booster. I want to make you aware right now there were two developments this week in the vaccines for COVID. Number one, this year they're trialing the combination. So in one needle, you would have flu plus COVID, and see if it's effective in preventing both diseases. The second is we have had the first successful test of a nasal spray vaccine for COVID. It's very early in the development. We've known for 3 years at some point we would be testing the nasal vaccines for COVID. I want to make you aware, and it's in the press, that the first test of the nasal vaccine for COVID has been done. It showed good protection in terms of developing antibodies. Now they need to see as we go through season whether it actually protects people from disease, and that's what's really important. So here we are, middle of October. Those of you with weather concerns for snow, rain, keep yourself dry over the weekend. Cold, freezing weather will be here soon, and that's when we worry most about the respiratory diseases, when I begin to worry about all of you out there. So have a great October. I'll talk to you next after Halloween, and then we'll really be able to talk about winter coming and what that means. So Doc, mid-October. Thanks, everybody. Stay safe, stay healthy.